Hi, everyone. It's Kelly from the Hub here today with our friend Roberta from WellSpan Health. How are you there, friend?
I'm wonderful. How are you?
I'm doing well. So we do all the horizon planning, end of life stuff, and unfortunately we know that the COVID cases are on the rise now, more than they have pretty much ever been. Let's just sort of put that out there that it is not good. So it is very timely that our topic today is, so you're a healthcare agent, now what?
Yes,
So
yes.
remind us about what a healthcare agent is, and then sort of like under normal circumstances, how that would be, and if things are different under COVID, or how we should be thinking about them in terms of all this stuff that's going on right now.
Yeah. So a healthcare agent is absolutely necessary to have someone who can speak for you that you trust when you're not able to speak for yourself. So right now with COVID, if you get intubated and put on a ventilator to help you breathe, you can't speak for yourself.
Right.
And so the doctors would rely on your healthcare agent, your healthcare proxy, to be able to speak for you because they're legally designated by you on a document called a durable power of attorney for healthcare form. And typically we say, don't just choose one person, choose at least two, preferably three, because if that one person isn't available for whatever reason, you need to have a backup. We need to have somebody else who could show up. And you need to pick somebody that's the age of 18 or older, so they have to be an adult. You want to pick someone who knows your wishes and can support them and wouldn't represent something other than what you would wish, their own wishes. So sometimes it's not best to choose your spouse or your partner. Sometimes it's not best to choose one of your children because they're too emotionally tied to you and they don't deal with crisis well. So this is somebody who needs to agree to do this. You need them to show up when you need them. I had the situation, Kelly, I've shared before, that after my husband died 14 years ago, I was 53 years old. What was going to happen to me?
Right.
He died of pancreatic cancer at 51, but I was healthy. I got my two best friends. A year later, unbeknownst to me, I was near death from a health condition, and I had to go into emergency surgery, and I called on both of them, and neither one of them could show up for me. And one of them actually said, I remember our conversation, but I don't remember what I'm supposed to do, and I don't know where the document is that I need. So you don't need someone like that.
I know that's
someone who understands.
Like when you tell that story, I get stressed out. Like that story stresses me out because you had people.
I picked the wrong people.
Yeah.
You have to know, and you only know by conversation.
Yeah.
So I also had somebody recently who just picked somebody, put them on their paperwork, but never talked to them. And I got a panic call from the person they picked saying, I'm not their family. I don't want to be in this position. Can you take me off? No one can take you off. You just then end up having to refuse. And look at the guilt that that's going to create for somebody saying, oh, no, I can't be there. I'm not going to be there. I'm sure my two friends felt really badly, because afterwards they were, oh, I'm so sorry, Roberta, but that didn't really help me. And it really caused a strain for us. So you want somebody who's an adult, somebody who will show up, somebody who knows what it is that you want, because you've written that down in a living will document. And you've been very clear in a conversation. So you've talked about your life experiences. You talked about, I saw Aunt Sally on a ventilator and oh my gosh, I'd never want that. Or, they were doing cancer treatments right up to the very last day. I wouldn't want that. Or dialysis was so hard. I think she should have stopped that, or he should have stopped that months before and at least had some time to spend with family. So you need to know those things of the person that you're representing. So if you are named as the healthcare agent, it's not just, okay, I'll figure it out when I get there.
Right.
We don't want that because we know from research That's how most of this happens. 75% of the time, the person you've picked doesn't really know that you don't want to be resuscitated, that you don't want to be put on a ventilator, that you don't want tube feeding, or that you do. You do want all of that to your very last breath. So getting cancer treatment until the absolute point you die, maybe that was the right thing for that 45-year-old. You know, we don't know until we talk to that person. And particularly now with COVID,
Yeah.
I have a friend whose mother just passed away at 91. Her son didn't know he had COVID. He lived with her. He gave it to her. She ended up in the hospital. Nobody can visit right now.
Right.
And so all of her children knew exactly what she wanted. They wanted differently. They wanted her to stay around. But when it came right down to it, the nurse said, "This is what your mother said that she wanted, and she didn't want." And so we need to honor that. And the kids got on board. And that's what you want from your healthcare agent. You want your healthcare agent to be that nurse that said, "Here's what mom or dad, sister or brother, uncle, best friend said that they wanted, and here's what I'm obligated to help them to achieve. What do I need to do to help you understand why that's the best choice?" Because as a healthcare agent, if your person is awake and able to speak for themselves and make their own decision, you're not called on.
Right. That's the easy time.
That's the easy time. That's when you learn. That's when you want to go with your loved one. If they've got some kind of chronic condition, you want to know what the prognosis is. You want to know how much time they have. You want to know when that doctor says, "I really wouldn't be surprised if your life ended over the next 12 months, that you might have just 12 months." Because then as their healthcare agent, you may be called on more often because they may end up in the hospital more often. You may be called on more often to represent them.
Yeah.
Because they're either in a coma or they're being medicated to the point where they're not awake and alert. They may be awake, but they may be hallucinating from the pain medication. They may be coming out of anesthesia because of surgery. You can represent somebody even if they're not in an end-of-life crisis as a healthcare agent. So it doesn't have to be the end. It can be just that. They're in a serious car accident, they're in a coma from that, or they're being treated, they're not awake. And so the doctors have to depend on you, but two doctors always have to say, "This person doesn't have capacity to make their own decisions. Now we have to call on the healthcare agent." We also need to know in Pennsylvania that a healthcare representative is not the same as a healthcare agent.
Oh.
So if you have not chosen a healthcare agent or agents, and you've not filled out the durable power of attorney for healthcare form that is available on our website through the 5 wishes, is available on the state website, is on UPMC, Penn State Health, Penn Medical, Penn Medicine. We all have documents that are these durable power of attorney for healthcare forms. They're free. You don't need a notary. You don't need an attorney. You just need 2 witnesses to make them legal. You need to fill out that form, because if you don't have that, then your loved ones have to go to court to be appointed, either as a guardian or as your healthcare representative. And as a healthcare representative, then you have to go back to court to have any decisions made on that person's healthcare until they're truly in an end-of-life situation. And then you still have to get approval. So you're constantly going back to the court to get approval.
I mean, that's complicated. It's time consuming.
And it's costly.
I was going to say it's
$10,000 to $15,000 typically to have that kind of hearing. So it's something that can be easily avoided by merely sitting down with a 2-page document, is what we use, that says, "Here are the people that I want. Here's their name, address, phone number, and here's what I want them to be able to do." So as a healthcare agent, what now? What now is you want to know, are you going to be allowed to make kind of your own decisions to interpret what should happen for your loved one based on their conversations in their document? Or does your loved one only want you to have the authority to do exactly what they've written. So those are the two positions a healthcare agent can be in. It's not you can just make your own decisions. That's not how it works.
Right.
You only can make your own decisions if your person has said, yeah, I'm going to let them interpret things based on the information they're getting from my healthcare team and two physicians. That's what's going to drive this. Or I have a living will, and I only want them to go by what I have in my living will. Those are our two options. But there's other things. Do I have the authority? Are you giving me the authority as your healthcare agent to get your bank records so that I can apply for Medicaid and Medicare or other insurance coverages?
Yeah, that's a
Am
big.
I allowed to take legal action on your behalf? So I've had families where the parent has identified who they want as their primary healthcare agent, and another sibling didn't like that, and they took them to court to undo it. And the court decided then that person needed a guardian instead of having anyone from the family being their healthcare agent. And that person needed the authority to take legal action on behalf of the person they were representing. So that's one of the choices. Do you want to be an organ donor? And in Pennsylvania, we can donate everything. It's not just our organs and tissue or blood. It's really everything now in Pennsylvania, and there's a special form to say that. So as a healthcare agent, you want to know, did my person say they wanted to go through the gift registry and donate their body to science for learning? Do they want to donate their hands and feet and bones and skin to help other people recover? Because we can do all of those kinds of things now. Yep. Anything that's viable. So you want to know that so that when the time comes and the people come for organ donation, you know how to answer that, what's allowable. Do you want to be put in a hospital, assisted nursing facility, assisted living facility, nursing home, hospice? Are these things that you want for yourself? Is there any variation to that? So sometimes I'll have people say, I never want to be in a nursing home. Well, sometimes nursing homes are the only facility to do rehabilitation.
Right.
So if you can't make that decision, but a decision needs to be made, and you say, healthcare agent, you can't put me in a nursing home, then how do you tie their hands? And what are the other options that might be available or not available? And so that's something to note. Can I move you as your healthcare agent? Can I move you out of state? So if I'm your child, I'm your primary healthcare agent, I live in Chicago. My family, my work is all in Chicago. You're now 100 years old and can't take care of yourself. And I'm your only person. Can I move you closer to Chicago so that I can take care of you? Would that be okay? Or because your friends and your home is in Pennsylvania, do I need to keep you in Pennsylvania and you're going to tell me I can never move you? We don't think about these things. We don't think about, we kind of think, oh, I'm going to stay in my house until I'm 120. I love my home. I've been here my whole life. I'm going to stay here. But then at 90 years old, I have a fall down my stairs. I have a 2-story house. I have a fall. And that fall, I've broken my hip. So I have to go from my house to rehab. But my bedroom, my bathroom's all on the 2nd floor. And if I'm sent home, I'm going to have another fall and maybe another one. And now my home is not safe. If you haven't thought about where you would go when that occurs in your life, then you're going to be put in a place you may not ever have wanted to be.
And might never leave.
And probably would never leave. Right. And you're not going to be allowed to go home and get your toothbrush and your favorite book and your house coat.
Yep.
You're going to be gone from the hospital to that location.
Yep.
And then hope that somebody will come. So that's a conversation you should have when you're well, when you can go and look at various facilities and you can say, maybe I could get home health care. Maybe I could get a visiting nurse service that could help keep me in my home. Those are things to plan for. So these are things as a healthcare agent, because you're able to represent them before they're even in an end-of-life care, you're going to be the person to help make some of those decisions. Where are they going to go for rehab? Where are they going to go if home is no longer safe? Does that mean they come to live with you or not? If you're a best friend, probably not. If you're a family member, you need to talk about whether or not that's feasible. And
Right.
for some families it is, and for many families it's not. And for some people, they don't want to burden their family with that, so they'd never want that to happen. And if you don't want that, you need to kind of have that conversation and make those arrangements. And then you need to be prepared to say, turn off the machine, unplug the machine, don't use the machine, don't do CPR, don't do anything to bring them back. They have said when they get to this state, they want to go home. Get them home sooner than later so that they have a quality of life at home to say their goodbyes and to die peacefully.
Right.
That's what we want. Know when they shouldn't go from their home to the hospital when you need hospice care. 6 months before they're going to die is a great time to bring in hospice care. Get palliative care for anybody that's got a chronic disease years before they die, because that's supportive and that brings a longer quality and quantity of life for people.
Yep.
So as a healthcare agent, this is your responsibility with the person you love who's picked you. And if there's more than one of you, how much better is that? That even though I'm the primary, you're the secondary, you're the third person in line. If we all have this conversation together, I've got support. I've got backup. I've got somebody I can say, you know, I'm not sure which way to go. Can you remember what mom or dad said? You know, what was your interpretation of that? What would you think we should do in this situation? That's also the value of having more than one person. And we also know if you do this work to learn what's needed, when it's needed, you won't have the depression, the anxiety, the second guessing. Did I do the right thing? Is this what mom or dad would have wanted? You'll know, and you'll have comfort and peace, and you'll be able to make sure that your loved one is dying in a way that is filled with dignity and love and concern.
Yeah.
And that's what we all want in the end, Kelly.
Yeah. I mean, this is a big job, but you are representing the wishes of this person. So it needs to be a big job. It's important that this is that way. And you're right. I think having, 2 or 3 people that are in that role can help ease some of that burden.
Yeah. And just think, if you're the person who's asked to be cared for and that person is not doing what you wanted, think about your distress, being trapped in your disease, being trapped in that death cycle that happens in the last few days of life. You can't speak, you can't make a decision,
right.
But you may be awake here and there. And, so often I've heard people say, please, please don't put me through this. I just don't want to die that way. And I've got family members who just cannot let go. And then they are filled with a lot of guilt about, I didn't do what they asked me to do. I did something different. And I don't think I should have.
We've both seen that in our lives. When I did hospice, and you'd have, you've done other things as well. And I have seen people who you could tell on the face of the person who was at the end of their life that these were not things they would have chosen. And it does not make the end good for anybody.
Yeah.
It's horrible. It's a horrible experience when it's not what that person really would have wanted.
Yeah. I mean, being the healthcare agent for my husband at age 50 and going through pancreatic cancer for 10 months with him, and then having to make decisions at the end that the family disagreed with, and now, for 14 years they haven't talked with me. I would not have wanted to be his healthcare. I wanted to be his healthcare agent. Yeah. I'm glad I was his healthcare agent. I'm glad I was there for 10 months to help make decisions when he couldn't, to help be his advocate every time he went in the hospital. I'm glad I could try to explain to the family, here's why we're doing this, or here's why we're doing that in terms of his healthcare, as they were reading, Googling this and that.
Yeah.
It was the hardest job I've ever had.
Yeah.
Because I adored him and I didn't want him to leave at age 51, but I wanted him to be peaceful. And I wanted him to have the best amount of care, and I wanted his family to be around him and friends to be able to visit. So to be able to have him at home instead of in an ICU or in the hospital was really the best choice.
Yeah.
And whether it's a heart attack, it's cancer, it's car accident, or it's COVID,
Right.
this is critically important. And with COVID, particularly because of the visitation restrictions, you need to know this. Even as a healthcare agent, you still can't go in the hospital. You have to do all
Right.
of this by phone or by what we're doing, just by a video link.
Yeah.
And so you have to be very secure and clear in your own mind that you know what you should know. And you've had those conversations. And if anything changes, if they create a new living will, that you've got that new document and that
Yeah.
it's with their doctors in their hospital. I mean, you're also responsible for making sure to recommend every 10 years that, you know, your loved one is checking their living will. Is it still right? Every time they get diagnosed with a new illness, every time they get discharged from the hospital, is there anything we should change in your living will? Is there anything you want me to know differently that I should help you change? You can't complete the document
Right.
as a healthcare agent. The only thing you can complete as a healthcare agent, you know, is that bright pink form, this bright pink document, the post. So this physician order as a healthcare agent, you are able to make the decisions on this. So particularly for those healthcare agents that represent people with dementia and Alzheimer's,
Yeah.
you want to know because you're going to be the person to help with this. This is a transport document from home to the hospital, hospital to skilled nursing, back home. This is the only document that emergency medical staff can recognize because it is a physician order. They can't go by anybody's living will. It's just the nature of the service they provide.
Yeah, and I also want to make sure that healthcare agents are thinking or know that they're not out there alone.
Oh gosh.
Every facility has somebody who will help you walk through stuff, whether it's the hospital, whether it's, you know, assisted living or a nursing home or whatever. There are people there to support those healthcare agents because they understand that this is really difficult. So I don't want people to be like, oh no, there will
Yeah,
always
I'm not going to do that. No.
right. There will always be people to help support you. And that's the coolest part because they're not there. The people at facilities, at hospitals or whatever are there to advocate for the patient, but they're there for you as the healthcare agent to advocate for you because you are making those decisions as the patient. So they're going to support you in those decisions that you make. So
And
yeah.
we know how emotional that can be. We know how
Yeah.
difficult that can be. And so you're right. I mean, that's my full-time job. I have several
Yeah.
people that's our full-time job is to have those conversations.
Yeah.
Our folks in palliative care and hospice care, that's their full-time job.
Yep.
Our doctors, our nurses, our case managers, they're all trained to have these conversations. And we're doing even more training with them, particularly now with COVID. And how do we deal with these changes in the way that people can support their loved ones?
Yeah.
So you're absolutely right. I don't want somebody to walk away and say, oh my gosh, I wouldn't want to do this. As I said,
Right.
I felt it was a tremendous gift to my husband to be his healthcare agent. And he wrote me a note before he died.
Yeah.
And gave me a necklace that said Serenity and said that is what I brought him by being his healthcare agent and his wife and his best friend.
Yeah.
But because I could represent him every hospital visit, it made it easier for him.
Yeah, and I also want people to know that, you know, like my mom was the healthcare agent from my grandmother 30 years ago. A lot has changed in 30 years. So you can't say, well, in 1972, when my so-and-so was doing the so-and-so, we have all of our minds are different. The way we see end of life is different. How we treat patients is different. So you can't use those things as the basis for making your decision now. And in other cases, I can understand that you can take those kinds of historical long-term approaches. But in this, I would absolutely not do that because a gajillion things have changed in healthcare.
Oh my gosh, yeah. Yeah.
Yeah.
Yeah.
So this has to be new. This is new.
It is. It is. All of this is not very old at
Right.
all. And, we've gotten better at the documents too. So documents like the 5 wishes is so much more comprehensive and is not written in legal language.
Right. It's so
written
much
in
easier.
everyday language that helps people figure out what are the questions to ask? What are the questions that need answered? What's the information I need? Our whole packet really covers soup to nuts on
It's
what you need
good.
to do. And then
I
we have
love
people that can support, we will come to your home. Even now, we'll all mask up and come to your home and sit with you for 2 hours and help you fill them out.
Yeah.
So that and have a conversation, have your healthcare agent right there with you so that we can all have a conversation together and they can ask a question to make sure they understand what you mean by whatever you say. Yeah, you're absolutely right, Kelly. Thanks for bringing that up.
Yeah.
That support is so critical.
Yeah.
And it's available with all of our health systems.
Yeah, this is, I think I say this exact sentence every time, but I feel the same feeling every single time. This is an invaluable thing because talking about this makes it normal.
Yes.
It makes it part of our everyday life, and it takes some of that mystery, some of the fear out of it, which is good because then you can talk about it normally. It's a normal thing. And so I love this series because I'm hoping that everybody goes, yeah, it's easy. You just do it. No problem.
Yeah. Yeah.
Like, I want everybody to be like, Psh, I've done that already. I talked to my grandma or whatever the situation is.
Yeah, it is true. It is true. That's what we're trying to do. Normalize it. None of us can escape death. None of us know when.
Right. It's going to happen.
None of us know when. So not knowing when means you want to be prepared.
Yeah.
Just like for so many other things in life, you want to just be prepared.
Right.
And if you've got a guide, if you've got something to hang on to, if you've got something to kind of help you along, it makes it much easier than just, coming up with, okay, now what? What do I have to do?
Right.
We've got lots of things that we can support people with doing the work and understanding what needs to be done and where documents need to go. Yeah.
I love it. It's just wonderful. Thank you, my friend, as always. We will chat again. All right?
All right. Take good care.
See you,
Stay
everybody.
warm.
Absolutely. Bye-bye.